The Australian Medical Association has issued its most damning report yet on the nation's public hospital system. It says the hospitals continue to be seriously underfunded and are struggling to meet growing demand.
The AMA says extra federal funding made available for an elective surgery blitz appears to have made little short or medium-term difference to the waiting lists. Matthias Cormann is the acting opposition health spokesman and he joins us now from the ABC's Perth newsroom. Thank you very much for joining us.
Good morning, Mary.
Good morning. Why don't you believe that that extra $600 million, which the Prime Minister says is an interim measure, why don't you believe that that has made any difference?
Well, firstly, Kevin Rudd keeps talking about $600 million, but it was actually much less than that. $150 million is all that was actually invested in additional services across Australia, which for my home state of Western Australia, for example, represents a mere $15 million out of a budget, $1 billion budget.
The Prime Minister has promised root and branch reform to come. What would the coalition offer?
Well, I mean, before the last election, Kevin Rudd said that he had a plan to fix public hospitals and that if he didn't make enough progress by the middle of 2009, that he would move to take over the running of public hospitals. Since then, all we've had is a 20-month review into public hospitals through the National Health and Hospital Reform Commission. At present, we're having a review of that same review with photo opportunities around Australia. Now, the reality is that the objective of health policy should be that all Australians can have timely and affordable access to quality health care, including, of course, public hospital care. The first thing that we would have done differently is we would not have been distracted by a return to an ideological crusade against private health insurance, which of course is putting additional pressure on our public hospitals. And there are a whole range of changes that can be made in terms of streamlining funding arrangements and in terms of avoiding some of the double-ups between Commonwealth and the state. But the point that we would be making is that Kevin Rudd, before the last election, promised the Australian people the world, and he has delivered next to nothing. We've wasted the last 2 years.
So do you believe that he should, in fact, take over the hospitals?
Well, I mean, we believe that it's time for him to actually tell the Australian people what his plans actually are. Before the last election, he said that he had a plan, and instead of implementing the plan coming into government, all we've seen is a bureaucratic review and now a review into the review. So we won't actually see any tangible action before the next election on his current timetable.
But in light of this report, would you support the federal government taking over the hospitals?
Well, we think it's time that the federal government actually told us what it is that they were planning to do. They've been in government now for the last 2 years, and all we've heard the Prime Minister say over the last 24 hours is blame the previous government. Before the last election, he said the buck would stop with him. It is time that he remembered his statements.
Matthias Cormann, what do you believe about the reporting system? We've heard that many hospitals, in some cases, actually have fudged their figures that they've had to report, that this report card is based upon. Do you believe that that reporting system is in fact fair, and would the coalition policy change that?
Look, I mean, the AMA has made the point that the figures probably embellish the real situation on the ground somewhat, and we would agree with that. But the real circumstance here is that over the last 2 years, things across our public hospitals across Australia have gotten worse, not better. And this, even though the Prime Minister promised before the last election that he had a plan to fix our hospitals by the middle of 2009, he thought he would make significant progress. Now we haven't seen any progress. Things are now worse than what they were 2 years ago, and it's time to stop the reviews, and it's time that the Rudd government started making some decisions.
Matthias Cormann, thank you very much for joining us.
Thank you very much, Mary.
And we should point out that the Federal Health Minister, Nicola Roxon, wasn't available for comment.